Hello, it's Dr. Rhonda Johnson. Today is Friday, September 17th, 2021, and today I'm going to be discussing the Mu variant. Well, this is one of the newest variants of COVID-19. It's known as Mu, MU, and now it has spread to 42 countries. The World Health Organization has named this a variant of interest, which is like a step below the variant of concern like the Delta variant. Some facts about the Mu. The Mu is the dominant strain in Colombia, South America, responsible for 1/3 of COVID cases. It was first detected in Colombia in January 2021, and now it's in more than 40 countries, including the United States. At this time, scientists do not believe this Mu variant will compete with Delta, which is the dominant variant in the United States and the world. And the reason is it's less contagious than Delta, which is super contagious. Now, Mu shares many mutations with the other variants of concern, and again, using this Greek alphabet designation, Alpha, Beta, Gamma, and Delta. It shares a lot of the same genetic sequences that, cause the mutations. Now, what makes Mu a concern to the experts is its mutations can help the virus escape immunity from the vaccines and also escape natural immunity from previous infection. So if you've had a COVID infection and you get infected with Mu, your antibodies and your immunity that you've had, even if it's vaccine or naturally acquired, may not be enough to protect you from Mu. Mu also has new mutations that has not been seen in any of the other variants. Now, there's a whole lot of people looking at Mu, and in a study which was not peer-reviewed, they felt that Mu was the most vaccine-resistant of all the currently recognized variants. Which brings me to move to another topic, which is I'm calling research on COVID. Now, here's something I want you all to remember. There's so much research coming out on everything related to COVID. I know it might seem like the scientists don't know really what they're doing, and partly that's true. There's lab research, there's clinical trials, which may have a limited number of people or medical records involved. Then there's the real world laboratory. And what seems to matter with COVID, to me, in my opinion, but I'm not a research scientist, is what's happening in the real world. So don't be discouraged by if you hear conflicting research. Some of these people on TV may talk about this study and then someone else comes up with a different conclusion from another study. All of that is just a good thing. It's a good thing that there are so many scientists doing research on this virus because, again, we are dealing with a global pandemic that the world has not yet seen. So, again, in the real world, look at Delta, what happened here in the United States. In May, Delta was 2% of all U.S. infections. And by July, it was over 80%. And by September, it's responsible for more than 99% of U.S. infections. In the real world, the vaccines are holding up to prevent severe illness and death. The numbers of unvaccinated people, folks, who are in the hospital, who are on the ventilators, and sadly, who are in the morgue, are proving this. The science in this pandemic changes fast, and if you're not an expert, don't try to be one. You can keep up with what the news reports say, but even I, who read a lot of journals, know that I can't read every last journal that's out there related to COVID, particularly the laboratory research and all the clinical trials that are going on with the therapies. So my advice is let the experts do what they do. Let them keep track of mu. Let them keep track of what's working, what isn't working. We just need to keep track of trying to beat Delta. Letting our guard down just one time can result in infection. Trust me, this is a lesson that I have personally learned. So be careful out there. Now, lastly, I want to talk about the monoclonal antibody. I received Regeneron made by Regeneron. It was that treatment that former President Trump got. 1 week ago today, I received a call that there was a cancellation. Sadly, the person whose spot I took ended up in the hospital, and I received the monoclonal antibody treatment, Regeneron. I was eligible for this treatment that is approved by the FDA under the emergency use authorization for high-risk patients with mild to moderate COVID-19 in order to reduce the progression to severe COVID-19 and or hospitalization. I repeat, it is an experimental treatment. It's a combination of 2 different antibodies that are grown in hamster ovaries. It takes a long time to produce these antibodies, about 6 weeks, and there are only a few companies that are producing them. Recently, the U.S. government purchased all finished doses, and that's like 1.25 million doses total, which isn't a lot compared to all the people that could need this therapy. Like the COVID vaccines, because the government purchased it, it will mean this treatment is free to Americans, although the hospitals can charge an administration fee because it's either given IV or through subcutaneous shots, multiple subcutaneous shots. But this is good news for people who don't have health insurance. So don't hold back on getting this life-saving treatment because you think you can't afford it. Because you can afford it now, and it's going to be provided to you free, although the hospital will charge for the nurses and the IV or whatever they have to do, monitoring you. It's quite complicated. It took 3 hours total for me to get that treatment. But in the meantime, folks, layer your protection, mask, hand washing, physical distancing, and do get the COVID vaccine. I think of this vaccine as a life-saving intervention. There's so much data that shows that it is. People who are unvaccinated are dying at 11 times the rate of people who have taken the vaccines. I like to think of it as protection, like an umbrella. It won't stop the rain. It won't stop you from getting completely wet. And even if the sun is shining, you know, many people throughout the world use umbrellas to protect against the hot sun. It will reduce your risk of getting burned by this virus. Think of the Delta variant as like water and hot sun. The virus has no power until it gets inside your body, and then it can move like water, and it can burn like the sun, folks. It really can. This is nothing that you want to experience. So be safe. Think about everything you do. If you're not vaccinated, please think about getting a vaccine and be protected against the burning effects of COVID infection. That's my message today. As always, my views are my own. My only intent is to help save lives. Stay safe and have a blessed day.